Healthy Living in the Four Corners has been brought to you by San Juan Regional Medical Center. We've all heard the stories. A young athlete collapses after running a play, then dies on the football field or basketball court for seemingly no reason. An autopsy later reveals that he died from an undetected genetic heart defect that caused a fatal cardiac arrest. According to studies sponsored by the Minneapolis Heart Institute Foundation, 1 or 2 athletes out of 200,000 have a congenital heart defect that can lead to sudden death. In the United States, a young competitive athlete dies suddenly every 3 days. Most victims are male, and average age at death is 17.5 years old. Although incidents of sudden death in athletes are rare, San Juan Regional Medical Center and the San Juan Regional Heart Center will offer free adolescent screenings on December 9th to find those who are at risk.
It's completely non-invasive. It's 2 components. One is a surface ECG or electrocardiogram. Someone would take off their shirt, and we use some little stickies that we place on the skin, and then we hook it up to an EKG machine, and it actually gives us a electrical readout of the conduction of the heart. And then the second portion, which is really very elegant, is a cardiac ultrasound, where we actually do an ultrasound just like you do an ultrasound for a baby. We use some gel that's clear, do an ultrasound of the heart, and we get to see all the valves, all the chambers for any abnormalities, any congenital defects, those kind of things. Whole procedure takes probably about 45 minutes. And at the end, the doctor actually sits down and talks with the family and the patient and said, hey, look, things are fine, or we found this little issue here. This is how we move forward.
The screenings will be used to detect any congenital malformations of the heart or vascular system that puts athletes at higher risk.
The most worrisome one that is there is something called hypertrophic cardiomyopathy, which is actually where part of the heart is actually genetically thickened abnormally, and that causes that's the source of an arrhythmia that then can cause sudden death. But some of the other things we can identify is some atypical rhythm disturbances, which we can detect from the ECG. We can detect, like, for example, congenital bicuspid valve disease, where one of the valves should be 3-leaflet, and instead it's from birth a 2-leaflet valve that then needs follow-up through time. So those are the wide array of things that we can identify. Again, all asymptomatic, but finding them preventively before they, and then arranging appropriate follow-up.
Although stories about young athletes dying suddenly generate a lot of headlines, Cheney emphasizes that they are very rare, and athletes and their parents don't need to worry needlessly. The free screenings are offered annually as part of the center's proactive heart health program.
It's almost like even screening for cholesterol. If you screen for cholesterol, you don't know you have really crazy cholesterol that was genetically handed to you. But if you know about that when you're in your 20s, we can address that before you have your heart attack when you're 40. So it's really kind of a similar kind of thing. Part of the screening is also to give, the athlete and the parents a peace of mind that their heart is fine, it's performing properly, and all those kind of things. Today's athletics, I think, is becoming increasingly more vigorous. I think the skill level is increasing dramatically across the United States, and so as parents and athletes move into that arena, just saying, oh, my heart's okay, I'm pleased with that. Now I'm going to worry about my knees.
The screenings are scheduled from 1 to 5 p.m. on Saturday, December 9th at the hospital at 801 West Maple Street in Farmington. They're available to all student athletes in the Four Corners. Screening participants must be between the ages of 13 and 18, and they must be accompanied by a parent or legal guardian. Pre-registration is required. Registration forms and more information may be found at sanjuanregional.com. I'm Deborah Uroda for this edition of Healthy Living in the Four Corners.